So hello all, welcome to a short tutorial on the topic Bordetella pertussis, which causes the disease whooping cough, a disease that affects the children, mainly affects the children. And Bordetella pertussis is a small gram-negative coxobacillus, and it is a strict aerobic bacteria, and it causes whooping cough or pertussis, which commonly affects the children. And the three subspecies species of Bordetella are Bordetella pertussis, Bordetella parapertussis, and Bordetella bronchoseptica. Among these, whooping cough is caused by Bordetella pertussis, which is a severe disease. And coming to the morphology, it is a gram-negative coxobacilli. It is non-motile, non-spore forming, and it is capsulated. And also it is strictly an aerobic bacteria, and it mainly spreads by respiratory droplets, not aerosols. It spreads by droplets. So a close contact is required for the transmission, and incubation period is about 7 to 10 days. The virulence factors of pertussis, most important one is pertussis toxin. So actually pertussis is a toxin mediated disease, and pertussis toxin can increase the cyclic AMP level in the respiratory epithelium, and this toxin is the one which is mainly responsible for the whole pathogenesis. Other toxins include filamentous hemagglutinin, which helps in attachment to epithelium, then tracheal cytotoxin, which destroys the ciliated cells, and adenylate cyclase toxin, which inhibits the phagocytosis. Now the pathogenesis. Now it spreads by respiratory droplets, and when we inhale the organism, it attaches to the ciliary respiratory epithelium, and it releases the toxins, and these toxins causes ciliary damage and mucus accumulation, which can result in cough. Okay, and the main feature of pertussis is whooping cough, and the disease is toxin mediated. Now the different clinical stages of pertussis. It has mainly three clinical stages. Incubation period is about 7 to 10 days, and in the first 2 weeks it is called catarrhal stage, in which mild cold-like symptoms occur, like fever, cough, malaise, etc. And it is highly infectious during this stage, and smear and cultures are positive in catarrhal stage. Then the first to 6 weeks is paroxysmal stage. It is the stage in which severe cough with inspiratory whoop occurs, and post to see vomiting may occur. That is, sometimes vomiting after the coughing may occur. And what is whooping cough? Whooping cough occurs in the paroxysmal stage. Whooping cough, it is a paroxysmal coughing in which bursts of 5 to 10 repetitive violent spasmodic cough or coughing occurs in each paroxysm, and it ends with inspiratory whoop. And whoop occurs due to rapid inspiration against a closed glottis at the end of paroxysm. And last stage is convalescent stage, in which gradual recovery occurs, and it occurs in 1 to 3 months. And coming to the lab diagnosis, the specimen is nasopharyngeal swab, and culture can be done in culture is the gold standard, and culture is done in bordered Gengo agar or Regan Lowy medium. And in culturing, it shows mercury drop colonies. Okay, so these are the mercury drop colonies which are formed on the culture, and it is the gold standard. And culture smear, if you take the culture and prepare a smear and do gram stain, it appears as ovoid gram negative coxobacilli arranged in thumbprint appearance. Okay, you can see gram negative coxobacilli arranged in thumbprint appearance. Okay, and PCR is most sensitive, and we can also detect the serum antibodies by enzyme immunoassays, and non-specific findings like lymphocytosis can be found in blood. Then the treatment, as the pertussis toxin mediated disease, antibiotics are less useful once the infection is established, but we can use antibiotics to eliminate the bacteria from nasopharynx. Okay, so for that, the macrolides are the drug of choice, and most commonly used macrolides for pertussis include azithromycin and erythromycin, and also clarithromycin. And alternative like clotrimazole, cotrimoxazole can also be used. And prevention can be done by DTaP vaccine. It includes diphtheria, tetanus, and acellular pertussis. It is given in 6th, 10th, and 14th week. and also booster dose in 1.5 years, and also 5 years are also given for DTP vaccine. Then complications include pneumonia, then CNS signs like seizures, brain hypoxia, convulsions can occur, then apnea, then death can occur in infants, and pressure effects due to violent spasms of coughing results in subconjunctival hemorrhage, hernias, pneumothorax, rib fractures, and petechia on the face and the body. And these are the you must remember all this, at least you should remember about this, that is whooping cough is caused by Bordetella pertussis, and it is a toxin mediated disease and spreads by inhalation of respiratory droplets, and lymphocytosis is present, and for treatment macrolides can be used, and DTAP is used for prevention. And it has mainly 3 stages: catarrhal stage, paroxysmal stage, and convalescent stage. And in the paroxysmal stage, which occurs in 1 to 6 weeks, the whooping cough occurs, and complications are pneumonia, seizures, apnea, brain hypoxia, and some death in infants, and also due to pressure effects, hernias, pneumothorax, rib fracture, all can occur. Okay, so that's all about pertussis.